Dr. Shangula said self-regulation is at the center of the bill and will set the standard for the conduct of all registered health professionals.
The bill also aims to fast-track the investigation of complaints relating to unprofessional conduct on the part of a health professional. I wish to point out that while the previous legislation made provision for the minister to grant special authorization for the health professional to work in the public sector, this provision was inadvertently omitted from the current draft. This provision has been lifted verbatim from the 2004 Act and submitted to the Office of the Attorney General for rectification. It will thus find accommodation in the draft bill during the discussion in this House.
SWAPO Member of Parliament Toby Aupindi complimented the bill, saying it will improve efficiency within the health management system and remove the perceived biases that locally trained health professionals are subpar.
The beginning of consolidation is very, very commendable. Because, for example, if somebody was to be trained in another country, you are now required to come and subscribe to our own standards. And they are very good. And it's very instrumental towards the protection of the public. Because let's not forget that the number one reason and the number one action of the health sector is to protect public interest and public health. And then again, it also removes the perceived biasness that were there. Because at the beginning, you used to have some perception that somehow if you were not trained from South Africa and you are trained from somewhere else, whether in the Americas or Europe or wherever, you were considered to be suboptimal.
Or out of place.
Yes, you were considered to be suboptimal, out of place. And then now it kind of like eliminates those sub-biasness.
PDM Shadow Minister of Health Winnie Mongo pointed out the mushrooming of educational health institutions.
I would also propose that compliance must be done yearly to avoid some of these mushrooming health institutions that we are experiencing and that we are seeing. We need to comply every year, compliance. Because if you also go to this health institution, you find a certain Selma who just graduated a nursing school, who don't even have a degree or a diploma in nursing education is lecturing some of these students. Nursing is no more a calling. It now has become a business. Yeah. It's a money-making institutions now, and it's really compromising the quality of care which is being rendered to the public out there.
Deputy Minister of Health and Social Services, Esther Munyangwe, said the bill will ease administration and there will be one registrar and one secretariat. Munyangwe added the new council will consist of 11 members compared to the current 51.